The most notable experience I had while volunteering in Shirati, Tanzania with Maji Safi group was the ability to learn to feel comfortable in a place that is so opposite of anything I have ever known before. No experience better embodies this than my first day when I went on Deep Outreach. Deep Outreach has the community health educators drive hours away from Shirati to a new community and distribute literature and education about water, sanitation, and hygiene issues. I had arrived in Shirati the afternoon before and had only met my fellow practicum students before arriving at the office the next morning and being ushered into a 4x4 Land Cruiser. One of my roommates was with me, although we didn't know who we were with, where we'd be going, and what we could expect for the whole day. We drove for 2 hours to Guchuma, a village that was having its market day. As we arrived, we were told it was lunchtime. I was already worn out due to a long drive on the bumpiest road I'd ever been on and no conversation between anyone in the car. Yet we reluctantly sat down at a hotel for lunch. We had been conditioned not to eat food that we hadn't seen prepared, but were told no other options were available. We were given whole grilled fish with fries and ugali. 3 other health educators sat down with us and began talking to us. They joked with us about being weary of the food since neither of us finished our portion or ate the fish eyeball. Afterwards, my roommate and I were paired with 2 of the health educators we had had lunch with. The task for the rest of the day was to walk around the market area and find groups of people to talk with and distribute information to. Our first group was all men sitting in front of a butcher shop. The 2 health educators were received very warmly and immediately offered seats. The more senior of the 2 educators began talking about oral fecal diseases such as cholera. As she was speaking, the group of men were engaged and asked questions. The other health educator translated, and we were both surprised by the level of participation in a group we had randomly approached. We spent 2 hours speaking to this group before moving on to a group of women that were selling vegetables. We sat down with them and discussed UTIs and yeast infections with them. I passed out pamphlets while the health educators spoke with them about how to avoid these infections. This group was as engaged as the first, asking many questions about what was discussed. We ended the day by walking around the market and familiarizing ourselves with the different foods available. Many people tried to speak with us, and the health educators helped translate. Everyone was curious to see Americans walking around their village. As we were driving home, I reflected on my day. It was crazy to me that people were so welcoming to strangers that wanted to talk about health education. It was equally surprising to me that after a day of new, culturally different experiences, I felt more excited than ever to be in Tanzania. I would need time to continue getting used to being approached on the street, eating different foods, boiling my drinking water, and learning some Swahili, yet I knew I could do it for a month since I had done it for a day. Although the rest of my visit included a lot of office and computer work, I still found myself in new, sometimes uncomfortable situations. And yet, that's what stood out the most about the experience and is a testament to what we can experience if we are willing to let ourselves live the great and not so great parts of traveling and volunteering abroad. I'd like to thank Austin College for giving me this opportunity, as well as Maji Safi Group for hosting me for a month. This is an opportunity that I won't soon forget.